So, Alejandro wears loads of hats, actually. I think you should have worn some of your hats to this one today, Alejandro. Alejandro does lots of things. So, Alejandro is a researcher at the University of Victoria in Canada, a PhD candidate in mental health at Lancaster University, whilst also living in London, which I think is a particularly formidable feat. And his research focused on realist approaches to mental health, with a particular emphasis on the role of lived experience researchers in driving organizational change within academic settings. Alejandro is also the founder of Raíces, which is the first global Spanish-speaking realist research community, leading initiatives to advance inclusive, collaborative, and linguistically accessible realist research across the Spanish-speaking world. Alejandro also hosts the Realist Lens podcast, which is a platform that demystifies realist approaches and promotes interdisciplinary dialogue through community-driven conversations. And his research interests include realist evaluation and synthesis, lived experience in academic mental health, and the cultural and linguistic dimensions of mental health experiences, which is why there's so much overlap and why we have so many conversations, Alejandro, because there's a lot of that resonates with a lot of what I do. Now, one of the things that I would just like to say to you is the Realist Lens podcast. Can you put a link in the chat so those that haven't come across it can find it? I know I've had a few one-to-one trainings this last month, and again through the group training, and the Realist Lens comes up as a particularly useful resource for people to learn about realists. I think someone said it was a space where realists hang out, I think was the phrase that was used. And I know that there's a couple of people that put it on the podcast whilst they're preparing dinner, driving, or looking after the kids at bath time and bedtime and stuff. So I think that format, which is completely different to the format that we're doing here today, works really, really well. And a lot of people have really appreciated the guests that you've had on there as well. So, and the variance as well. So you're not just, speaking to what I would call the people in the upper echelons of the realist police, but you're also speaking to realist researchers who are still grappling with some of the challenges themselves. There you go. That's the link to the Realist Lens. So those of you that are not aware of it, you can go and sign up and you can follow it as well. And then we're going to move to Mita. Now, Mita and I haven't properly met, but now we have, and we will be meeting more. I know we are. So Mita is an early career researcher whose work is currently focusing on issues of racism, discrimination, climate change, and health. Her past work includes research with NGOs and academia about gender-based violence, health, and intervention design. She has experience working with artistic methods and is particularly passionate about supporting migrant communities. These experiences have informed her focus on structural change as a guiding principle to public health. So that's our two talkers. That's our two speakers for today's talk. So I'm hoping that if anyone was stuck in that other room, that they have now managed to make their way across. If there was anyone else other than Beth, we've got 33 people, which is about what I expected given the number of signups. So I think if we just pass over to you and start moving, if that's all right with you.
Sounds great with me, Joe. Thank you so much.
Perfect.
And I guess to everyone, good morning, good afternoon, good evening from wherever you're joining us in the world today. I know there's some people joining in from Canada. There's some people in the UK. There'll be some people from all over the place. So it's very excited, and it's an honor to be here to explain a little bit in the work that we've been doing and that we're still doing in this project, specifically around initial program theory development and data analysis. And we're going to take you through the work that Mita and I and the rest of the team have done to get to a program theory. We'll explain a little bit more into what it is. I know we are in a realist room, but people will probably be at different stages on that journey, which is brilliant. This is what these sessions are about for everyone involved in the realist world. And we're going to get straight into it. So can I get the old thumbs up, microphone, anything along those lines that people can see the slides, please? Fantastic.
I can see it, so hopefully we're all okay.
Brilliant. Thank you so much. So the purpose of today, and just to give you a little bit of the overview of the session, I'm going to take over the first half for around 25 minutes, and then Mita will take over the second half for another 25 minutes or so, and then we'll leave room at the end for questions, thoughts, comments, heckles, anything that comes to mind that you want to share. That it will be absolutely welcomed. And of course, most importantly, the debate and understanding that comes with the realist community, that it's always open, exciting, and very energetic. So the Work, just to give you a little bit of a background as well, is led by Dr. Nancy Clark, who is joining us today in this call all the way from Canada. And it's made possible through the team of 4 of us working at the moment on this project. So Mita, Ferdi Mukambang, which I'm sure many of you will have heard, Nancy and I. And this project has been funded by the Michael Smith Health Research BC. This is a 5-year project looking at integrated mental health care for refugees in Canada, but also in a realist review a little bit more widely. So we really thank as well the funders and the grant that makes this work possible, and also all the work from Nancy, our PI, to get things moving and to ensure that things from Canada from our side are working, because it's a truly international team from London, Mita joining from Seoul, Nancy in Canada, Ferdi in Washington in the US, so a very exciting international team working on this project. Quick overview on where we are. As a 5-year project, it's been separated into different phases. So phase 1, which is what we're going to be talking about specifically today, and this will probably be quite helpful, is around the initial program theory development. Now, because of the timing of the project and because of the nature of the timeline, we decided to build this initial program theory in phase 1. You don't have to. You can build an initial program theory at the start of your review or anything along these lines, but we were very specific to have some time working on building this IPT. And the whole session today is to tell you the analysis that we did to get to that stage, to get to the initial IPT. Where we are right now as we speak in this project on integrated mental health care for refugees, and I'll explain a little bit of the background to set the scene, we're doing the realist review at the moment. So Mita and I are working currently in the full text screening in the weeds of Ryan or Covidence, whatever you use, to ensure that we're getting the right papers and the right grey literature and the right material, because we know it can include many things to that stage. And then over next year and the other, we'll be working on a realist evaluation as well to put it forward. So a very heavy realist project. And what we're focusing specifically today is the initial program theory development. Disclaimer. And this is a very important slide just to set the scene and set the expectations before we get started. First things first, we're going to show you the step-by-step process of what we went through in our study, what's helped us as individuals. But this is not a recipe. So what we say today does not necessarily mean that it's the only way to get into an initial program theory. In fact, there's many, many, many ways. And one of the most important things is, are you subscribing to the realist subscriptions that you're doing, with the ontological ideas and the theoretical ideas? That is very important. What we're showing you today is one way, not the way. We hope it can become another toolkit in your another tool in your toolkit, so to speak. You may love it. You may think it's not for you. No problem. It's just another way to understand realist analysis, and we hope you find it useful. It definitely has been for us. Again, this was for an initial program theory development. This is not necessarily a middle range theory, so to speak, and I know that's another piece of jargon. Essentially, the middle range theory is slightly more abstract, and this is around the initial program theory of this specific context that we were doing in BC, British Columbia in Canada. We're looking at the middle range theory in the review, but just so you know, what you're looking at today, it's an initial program theory. And also this approach that was done by an all realist team. So the team and the 4 of us involved in the project have all had experience with realist in the past. So also that's probably impacted some of the decisions of combining 2 approaches, for instance, of the linked codes and the realist thematic analysis. And we'll speak what that is, but also to understand around the alignment and the context of the team. So just a couple of disclaimers. Most importantly, this is one way, not the way, and we hope you find it useful. This has also been written as a paper in International Journal of Qualitative Methods, currently under review, and you can have another full read if you wish, hopefully once it's out. A little background on the project, and just to give you a sense into what you're seeing and what we're working with at the moment. So I think this number actually has increased since I created the slides not long ago, but around 117 million people, as I mentioned, probably a little bit more, but a lot of people currently in the world need an international protection, either through status such as refugee, asylum seekers, people of forced migration, displacement. And what we find with this population is that there's very high rates of mental health experiences, mental health challenges. Some common diagnoses, you can see PTSD and depression. Essentially 1/3 of everyone in this population appears to have some sort of mental health challenge of diagnosis of this level, which is pretty high in comparison to the say general population, which is also high, but this is pretty high as well. So in itself, there is a problem to be solved. Most importantly, what we see is that mental health is shaped by post-migration social determinants. So once someone reaches the new country, the country, the destination country and the host country, there are plenty of issues of the individuals that experience that. You could have system navigation problems. There's a lot of language barriers, of course, that people that arrive. And not only mental health, but you have all the other social determinants that need to be met: housing, employment, access to settlement support. And even so, I'm talking here about post-migration, but actually there are other two areas where mental health is also shaped, which is the pre-migration and migration. So all this journey is going to shape the mental health experiences and challenges of the population that were interesting in this study. And we know and we share that mental health care is a human right. So in order for that to happen and to meet the needs of this population, which is something that is only increasing and increasing, we need to strengthen supports and services. But there's barriers that providers face. You can probably think of some of them within your country, within your context, which is the healthcare context. But you can think around limited time, there's unclear coverage, there's lack of language responses, limited cultural and understanding. And of course, one of the areas that we're really looking at is around equitable access to these services. And unfortunately, there's quite a lot of gaps, because we see that these services are not necessarily working together when it comes to mental health specifically. It's pretty siloed how these different systems work. A lot of the services are being done by these community health organizations, community health services, but not much integration is being done around mental health, for example, in primary care, which we know is a point where many refugees and people of forced migration and people needing international protection may need the support. Most importantly, from a realist lens, we have a lack of theory-informed models for integrated refugee mental health, because we see that integrated care models appear to be quite useful. We see that appear to work in other areas, in different populations, that improving the coordination, continuity, and quality. So it appears that it could be a good solution towards refugee mental health services, because a lot of the literature is focused really on the individual level resilience and the resilience of people going through these experiences and mental health challenges. What we're very interested in as well in this project is the service level resilience. Are services ready to meet the demands of the amount of people that they need this support? And the service level resilience becomes very important. What we don't really know is how this looks like, who it should work for, in what conditions it works for. Now I'm getting into the realist conversation, because we still don't know and don't have much idea of this integrated mental health care for refugees, essentially in primary care as well as a point of contention that we're really focusing on, but just generally as well. So we're hoping that through a realist approach, we're building this theory, we're building these ideas to understand what works for who, how, in what context, and why. Think about it a little bit as an ex ante evaluation, in a way, what we're doing, because we're not evaluating something that exists. We're trying to create an idea and a model, a theory that could then use to be the design and development of integrated mental health care for refugees in Canada and hopefully in other areas. That's a little whistle-stop tour of the topic and what we're talking about today. And we are using a realist approach, digging a little bit deeper, as the image shows here, around some of the context, mechanisms, and outcomes. I know I'm speaking to a widely realist audience. I'm not going to spend a lot here, but just some of the key ideas of the realist approach for those individuals who may be starting or who may just want a little refresher. So realist approach, realist thinking rather than methodology is more a way of thinking, some subscriptions that you're making in that journey. It helps us make sense of complexity. We're embracing complexity to understand social interventions, programs, or phenomena. And as we know, it starts, in the late 90s, not the realist philosophy of science, but realistic evaluation. And since then, it's grown quite a bit, which is quite exciting in the complex world that we live in. And we're not going to just focus in our study or any realist study if integrated mental health care works or not, which, by the way, that's also a good question to ask. But we are also interested in why does it work? How does it work? For whom does it work? We're trying to not only show, if something works, we're trying to explain. We're trying to go a little bit deeper to understand how does integrated mental health care work for this population? What is it about integrated mental health care that leads to certain outcomes? That's a very good retroductive question. Because as we know, some of the things that you're subscribing as a realist is around this mind independence, that reality, what's out there, exists independent of our observations and thoughts. And we know this, with the classic example of the tree in the forest. If there is a tree in the forest that falls and no one's there listening to it, has it made a sound or not? Now, with a realist mind independent, it's made a sound regardless of our perceptions, what we think of it, that reality exists. Gravity exists if we think about it or not. These mechanisms that are in the world exists. However, we're using theories to try and understand this reality. And these theories that we're doing around the mental health care for refugees are helping us understand this reality as well. But it's always going to be fallible. We're never going to reach the full picture because these theories, and it's called the semantic notion in realist, help us understand a little bit, shed some light of that reality, but it's never going to be the full picture. That's why we're always going through a theoretical conversation and updating our ideas and theories. What causes things to happen is not necessarily what we see in the surface. This is what we call generative causation. There are some underlying mechanisms, things that are occurring underneath the surface, like the little spade here, that cause things to happen. And they interact with context to lead to outcomes. And this is where we have the famous CMO configuration, which again is a heuristic, a way of thinking to start theorizing about why is it that some of the things that we're seeing are happening. You don't have to use a CMO configuration. You don't have to use, you can use ICMO, CSMO, you can use explanatory inferences. It's a way of thinking to theorize about what's happening in the real world. So it helps us to think and explain and improve social programs and other programs. Some of this you know already, just a little refresher to get us warmed up for this, which is the analysis of our approach. So how have we got to an initial program theory, our understanding of integrated mental health care, how it works? This is a big picture. There's a lot going on. We're going to break it down step by step for everyone. We're going to go through the first phase that we did here, which is the preparation phase. We're going to then explain the phase one, the diets and triads of Jackson and Kolla, and how we combined that with a realist thematic analysis, and then getting to more abduction to reach an initial program theory. We're going to walk you through all this process, but most importantly here is to understand that each phase, as you can see with these black arrows on the screen, has informed each stage in order for us to reach an initial program theory. Now, a very quick fire exercise, a quick challenge for everyone, a little competition. So just for around 3 minutes, and I'm going to be timing this here on my clock, I want you to have a think of one key realist concept. I want you to think of your favorite one that you like. It can be mechanism, it can be context, retroduction. Just think of a context, a word that's very realist. And in this next 3 minutes, in the chat, I want you to list all the different ways your chosen concept has been defined. So for example, mechanisms, you can say Asprey and Liu, which is more around context-sensitive hidden causal forces, or indeed Sonia Dalkin explaining it as the separation of resources and reasoning, etc. So if you choose one of your concepts for 3 minutes, see how many definitions you can recall. On the chat, I'll give you 3 minutes to do this, and I'll give you 3, 2, 1, go for it. On the chat, how many definitions you can think of your concept. Have a little think, and once you have something, make sure to add it on the chat. Thanks, Joe. Too many to count, including my own definition of retroduction in my PhD, which is incorrect, with a lot of exclamation marks. Thank you. Absolutely, there are quite a few. Can anyone, you got around 2 minutes, 10 seconds. Context. Backdrop characteristics of the settings people might influence change, but no causal nature. Okay, thank you, Rasha. Keep them coming. How many ways can you define these things? You're on 2 minutes. Quick fire, a little bit like the image there. IPT, Antonio, yeah. If-then statements, yes. About how context mechanisms can interact, absolutely. You can use them as an if-then statement, if-then because statement, absolutely. Thank you. On a minute and a half. IPT, candidate program theory, so you could have CMOCs, final CMOCs, overall CMO configuration, visual depiction. I still don't really know which one it means. Brilliant, thanks, Beth. That's a really good, really good different things about what a program theory could be like. There's a lot of words, isn't it, when it comes to program theory and conversations. What else do we have? IPT, hypothesis, if-then statement, yes. Outcome, endgame, endpoints, results. So what? Mechanisms, and yes. CMOs, batches, PTs. Nancy, context, environment, ethos, sociological conditions, often confused with settings. Absolutely, Nancy, thank you. That's very important. Mechanisms, resources need reasoning. CMO, ICMO, IPT, gleaning, Mukenbang. Yes, so that's it. Third, you're talking about that and ICMOs as well. Fantastic. You have around 30 seconds left. Any others? Any other takers? Any other definitions out there that are in the literature that you may know of? Only a couple seconds left. I'll leave it. Context, causing, mechanisms to fire or fail to fire. Thank you, Faye. Program architecture for resources. Thanks, Joe. Yep, that can be very useful to understand. 10 more seconds. Let's have a look. 10, 9, 8, 7, 6, 5, 4, 3, 2. Perfect. Brilliant. Woo. So just with 3 minutes, what we see here already is just in the chat, so many different definitions. I mean, Joe made it really, there's too many to count, and we could be here not only 3 minutes, but 2 hours, and we can be here with definitions. Why do you think this is a useful exercise just now for what we're going to speak about? What's useful about, knowing about this and all these different definitions? Any takers? You can put your microphone off, you can put it in the chat. What do you think?
I think, hi, this is Rasha here.
Hi, Rasha.
I think it's particularly helpful because you kind of keep checking your understanding of those definitions. So for example, I work a lot in terms of, because I work in the area of implementation, and I work a lot with context and how we define context. And as someone said in chat, we keep kind of confusing it with the setting, and then we sit back and think, what is it about the setting that could describe our context? So I think it's important that we kind of keep verifying and checking our understanding as we go and do that realist work.
That's a great response. Thanks, Rasha. And I see some other things in the chat as well. That more than one way to doing understanding diversity, which is great. Absolutely. When it comes to your analysis and when it comes to your analytical procedure, the most important thing that you have to think on before jumping to the analysis, there's a lot of ways of defining things. You may have been in a team that is doing a realist review or a realist project that they've done maybe several trainings, they've read several papers, they've read several books. So what's important is to ask as your team, are you aligned on the definitions that you're using in your project? Are you agreeing on your analytical strategy moving forward? So before you're thinking of coding, before you go into the weeds and the depths of NVivo, Atlas, TI, Word, or whatever you're using, are you aligned in what you're defining? Because even in 3 minutes, you've just seen that there's so many ways to do it. There's so many definitions. So can you be aligned in your team? There's a really good chapter, which is in the resources by Nilsson and Lemire in Anna Manzano and Emma Williams' new book of 24, that provide helpful guidance of choosing an analytical strategy that can be useful for your specific project. So in here specifically, what you want to do, at least what's been really useful for us, is that we piloted the analysis just using, a couple of pages of a transcript. We met every week to do this, to refine our definitions, to ensure that we're on the same page, that we have a shared understanding of what a context is, what a mechanism is, and be aligned in that process. The key word here for me would be to slow down to speed up. Even if you're on a deadline and even if you have some time, even taking some time to slow down at the start of your analysis is going to speed things up afterwards, because you're not going to have to go back to people and think, is this what you think? Is this what it is? Is this, am I getting, you're all aligned from the start, and it's going to be really useful as you go through that. Some quick questions that we asked at the start of our study. This helped us, but of course you can ask many more. I've separated them in color because some are really specific, some are more widely to other research that you could use. But first of all, are we all clear on what we mean by realist analysis? Not everyone in your team may have had realist analysis before, so maybe it's a good question to ask. Are we clear of what we mean by this? Number two, can we define what we mean by the different components? In our case, we use ICAMO for our project, but you may use another configuration, you may use something else. Can we align on intervention, context, actor, mechanism, outcome? What do we mean by all these components? Are we aligned so when we're doing our coding, we know what we mean? How does retroduction differ from other reasoning approaches, and what does it look like? So when it comes to retroduction, how does it differ from induction, from deduction, more explanatory inference? How do we go into the weeds and the depths of mechanistic thinking? It's quite important to try to understand this process a little bit. Some other questions, that are quite general but very important. What are the timeline expectations? Remember, realist is quite iterative, so how long do we have to finish this to help you choose your strategy? What are everyone's roles and what is expected of each other? Who's doing the analysis? Who's doing the checking? Who's doing the review and the iteration? What system? Please be aligned on your system. What are you using for your analysis? Teams, Google Drive, anything that you're using, be aligned. It's iterative. There's going to be various variations in the way that your IPTs are coming together. So make sure you have a really clear system as a team. And most importantly, opening the door. Are there any questions? Is anyone unsure? There's no issue in asking questions if someone is unsure. So these questions may help kickstart your realist project as well. There will be more, but most importantly, spend the time to slow down to speed up at the start. I promise you that this is not the start of a bad joke, and this is not a pub quiz question either, but what do these things have in common? Which is Noah's Ark, yin and yang, and a pair of socks. On the chat or by the microphone, does anyone have any ideas what these three things have in common? Very random things, I understand. Pairs, 2 by 2, two of them, linked, fantastic, very good, thank you very much. I was thinking of doing this slide or maybe putting, the three little pigs or the three musketeers if we were doing in threes, but absolutely. This always come in twos and come in complements, a bit like the animals in Noah's Ark, the yin and yang, and a pair of socks. So the first thing that we did in our analysis is to use this idea as well of Jackson and Kolla's dyads and triads. The original paper is from 2012 and it is on the resource list, and we used this our first step to get to an initial program theory. So we had to use this approach before and we found it really useful for getting started. And we're going to explain a little bit. If you're thinking about, the animals in Noah's Ark and you're thinking about the pairs of socks or the yin and yang, this is exactly what it is with twos or threes. So this is a method for coding qualitative data. So it's going to be very useful if you're using interview transcripts, for instance, if you're using that qualitative data more than numerical data, and you're going to capture from participants' narratives, from the things that they're saying, the connections they make as they're coding these dyads and triads together. And this is a very useful approach to start configuring from the start. to start thinking in configurations and not in catalogs, which, as we know, it's something that is not necessarily realist, which is just this is a context, this is a mechanism, this is an outcome, putting a list. That is not necessarily realist because you don't see the causation, the domino effect between the three things. What you're trying to do here is, from what they're saying in their interview transcripts, how are we combining how is the person, in their own words, combining the context and mechanisms, mechanism context, outcome context. Maybe they will say that in there, and we're going to give you an example now. Or triads, maybe in the way they're saying something, they come with a CMO, with an MCO, with an OCC, that it becomes really clear as you're doing your transcripts and your data. So what does this avoid, and why we chose dyads and triads? The first thing is helps avoid cataloging, which I mentioned around that, which helps to lead to deeper analysis. You're thinking retroductively with depth and with explanation from the start, from the inferences and coding that you're making, from what the interviewees are saying. Because the goal for us, of course, in this case, was to develop a robust program theory. So in order to do that, we need to ensure that we have those configurations very clear for us from the very start. And there is a very good episode 11 on the realist lens that the person who, Suzanne Jackson, who created this with a colleague Kolla, explains everything around this concept as well. So I encourage you, if you want, to listen to that episode as well, because she explains everything about it. And most importantly, think about, am I making the connections from the onset between the dyads and triads that people may be sharing in their transcripts? I'll give you an example of that. So this is a transcript from an individual that we interviewed in our things, anonymized completely, and this is a dyad example. So in here it says, so good examples in the Paris system. We've had what we call the rehab team, and the rehab team is comprised of the OT, the break therapist, myself, the employment counselor, and who is on that team? Just the four of us on the rehab team. So we have our own referral system. So anything that comes through that system, that will be our immediate focus. So again, on the chat, if I were to ask, what kind of dyad would this be in your understanding? Would you consider this because we've highlighted in two colors, so therefore it's a little dyad. Do you think this is a context outcome dyad? Is this a context mechanism? Is this a mechanism outcome? What kind of dyad do you see after reading this little extract? So we have the yellow and the pink. Okay, so we have a context intervention or no, CO, context outcome, okay, context mechanism, okay, context mechanism, fine, context outcome, fine, context outcome, context mechanism. Okay, so we're very clear on the yellow bit. So we're saying, okay, this could be a context, nice. In our own work, we also assessed the pink as an outcome. So the outcome is the immediate focus to the referrals. So the context, the pre-existing system structure, including the team composition and ownership of the referral pathway. And the outcome is that you're going to focus on something. If you were thinking more retroductively in this case, you may want to ask the retroductive question, what is it about having your own structured team, own referral system that triggers this immediate focus? So as you're going through your transcript, you're going to start looking at these dyads and triads, these connections that people are making already through the whole interviews that you're working with. And that is your first step, which is building these connections from the onset. For steps 2 and beyond, I'm going to let Mita take over. And to do that, I'm going to stop sharing the screen and let Mita share her the slides.
Thanks, Alejandro. Can you guys hear me okay? I think I'm having slight connection problems, and I just want to make sure coming through clearly.
Absolutely
perfect, Mita. Thank you.
Yeah, perfect.
Amazing. Cool. If anything happens, just please interrupt me. I don't want to come off unclear. All right. Give me 1 second while I share the slides. Okay. Oh my gosh, I always pick the wrong button. I'm sorry, guys. You're going to see another quick run through of Alejandro's slides. Okay, so I'm going to pick up right where Alejandro left off at the dyad and triads, and we're going to work with this coded sample for the rest of the presentation. I'm going to spend the next approximately 20 minutes talking about our analytical process, which can be subdivided into about 3 steps, with the last step having a couple more sub-steps, but I'll keep it simple and I'll keep it clear. So we're going to go from this coded sample to what's known as an experiential theme, which is basically an abstraction based on participant experiences documented in the data. From there, we're going to move into an inferential theme, which is based in part on the experiential theme and invites the researcher to bring in, through inductive reasoning, their own understandings of the research in the field. That abstraction is taken even further and gets closest to the realist heart of this at the dispositional theme, which is an abstraction based on interrogation of mechanisms based on the prior themes. Now, this is presented linearly, and I just want to caution everybody that it's not always linear. You might find that you're identifying inferential themes while you're developing experiential themes. A lot of this stuff can, you might come up with a dispositional theme as you're coding. So just don't necessarily take it linearly. I'm going to pause on the experiential, inferential, dispositional, and I will get to exactly what those look like in practice in a second. And I just want to touch on a very little bit of theory. This is a realist audience, but again, we are on different levels. So pardon me if you're hearing these things more than once, but we're going to talk about the different levels of reality through a realist perspective, and that's the empirical, the actual, and the real. And I'm going to talk about this through the classic flower metaphor. How many people have gone through the pleasure of hearing this over and over? Go ahead and go add hearts if you heard this before. But imagine you are looking down at a flower from a bird's eye view. What you see are the petals and the center. You can think of the empirical level as that part of the flower. It's observable. You can take a picture of it, and if you take, that's your data. You can see it in your data. Consider the stem. Assuming that this flower is alive and well, there has to be a stem that supports the roots and connects the nutrients to the flower itself. You may not be able to capture it in the data. You may not be able to see it in that photograph. You might not, as a researcher, be able to immediately observe the stem, but it is there. And then you've got the real. Imagine that root system underneath the flower. It's covered by soil. It's not visible, even if you looked under the flower, but you know it's there. And not only that, you can see the quality of the soil, the health of the root system, all actually shapes the way that the flower itself looks. And so you can actually see the interaction of all 3 parts of the flower happening at once. That's, I think, one of the ways I appreciate hearing these different levels explained. So you've got the dynamic, imperial, actual, and real, and they're all working with each other. But if our goal is to look at data and understand it, how do we parse apart the interaction between these 3 things, and what does that look like? Well, same flower, smaller. Revisiting the experiential and inferential and dispositional themes, we can use those themes to structure our understanding of that dynamic. Now, I'm drawing off of some scholarship done by Wiltshire and Ronkainen, and I've left a citation in a resource slide at the very end, so you'll have all of that. But essentially, what we're trying to do is structure our approach, and this is the approach we've taken. Again, back to that disclaimer, it is a approach, it is not the approach. So take it with a grain of salt, and I hope you enjoy. We're going to start with our experiential theme. So this theme is defined as a subjective viewpoint, such as intentions, hopes, concerns, beliefs. These are all very attached to the participant's perspective and observations. The way that we initially started to explore these was that Alejandro and I developed themes by reading the data and discussing it. we identified through this discussion themes that best represented participant experiences. Subsequent quotes were extracted. This is kind of the evidence of our experiential theme. And it kind of looked like this. Now, I've made a really simplified table, but what we did was we both had our own tables. You got the experiential theme in one column and the quote, and it will grow to include the inferential and the dispositional. The way that you document, or the way that we've been advised and the way that we documented our experiential themes, was we started with things that really led our writing through the participant. So the participant explains or felt or saw things that really grounded our perspective in the participant's perspective. So these are just placeholder quotes. They aren't really taken from anywhere. So let's actually see this in practice. This is the same quote that Alejandro showed you earlier. It's just not highlighted. I'm not going to read it, but I am going to read you the experiential theme that came out of it. So the participant in this dialogue described the role of structured referral pathways and integration between teams in ensuring continuity and reduced confusion. So in essence, structure helped continuity of care and clarity of the process. Once we reached this experiential theme, we then went on to the inferential theme. So the inferential theme are inferences and conceptual redescriptions using more abstract language. What this does, and what developing inferential themes does, is it helps us move beyond firsthand accounts and identify unobserved explanations for said phenomena. You can inductively infer what might be happening based on your experience, maybe conducting the interviews, interest holder engagement, expertise within the field, you name it. We compiled another, long list based on our experiential themes so that the inferential is linked with the experiential and the quotes, the exact data. And the way we documented this is we used plausibility in the language to help retain that in what is it? The inference. I don't want to sound too repetitive, but I can't think of another word. So it's plausible to claim that X happens when Y. It's plausible to claim that C leads to D. For us, it's plausible to claim that a structured referral system facilitates team integration, improving coordination, and ensuring that cases are managed effectively or efficiently without unnecessary confusion or duplication of effort. Notice here that we've moved from participant described to it's plausible to claim. I might seem a little trivial, but the language around this has really helped me personally in creating that abstraction. So once we were done with the inferential themes and we created this table that you see here, just, populated with the data itself, we moved into the dispositional theme. Now, the dispositional themes are theories about the properties and powers that must exist in order to produce the phenomena being studied. These are hypothetical causal explanations based on the relevant literature. What we did was we met to come to consensus. We documented our consensus. We decided, these are really similar. Maybe we should collapse these. We had the same thought here. Maybe we can rewrite this as one. Maybe we can just go with Alejandro's. Maybe we delete this one. We created final statements that summarize the themes that we developed. And I will show you a picture of this to give you a visual. But basically, we did a lot of work to refine, rework, and come to a theme that really represented those underlying hidden causal factors that were going into this. And it looked like this. So you've got the same table, but just now on the right, the dispositional theme. Event X is dependent on the existence of XYZ, which enables ABC. Notice that most of these descriptions refer to something, event A, being dependent on the existence of another thing. In practice, We move from participant described to it's plausible to claim to the inferred phenomena is dependent on the existence of a structural preference for streamlined processes, which enables providers to focus on care delivery without being distracted by administrative burdens or inefficient workflows. We are not done with the dispositional themes, and we are not done with thinking backwards. I guess you could call it thinking backwards, but I want to zoom out and kind of regroup to talk about where we are in the process. So again, we've gone from the coded sample. The coded sample feeds immediately into the experiential theme. The experiential theme based in the data then goes on to an inferential theme. We then go into a dispositional theme, which should be able to explain like the significance of the inferential theme and how it's rooted and linked into throughout the experiential and the data. I hope that makes sense. If you guys need clarifications, pop it into the chat, raise your hand. But that's where we are now. So what we're going to now talk about is how we move from this part of the analysis to our eventual initial program theory. I want to revisit the table for a second, because I think when it comes to analytical alignment that Alejandro was talking about earlier, but also just making sure the team is acting like a well-oiled machine, we have to check in with each other and we need to get the whole team's input. So as you can see, we have our consensus, the documentation that Alejandro and I made about which theme, how did we decide yes or no on this, and which one did we go with? Well, we also had in yellow, as an example, validation from our principal investigator, Nancy. So Nancy is a critical feminist scholar, a mental health nurse with like substantial amounts of experience in this field. And on top of that, she led the World Cafe that started all of this. So she knows this project. What she did was she went through our entire table and identified, okay, like here's where the data lines up with a paper that I know to be true. Here's where the theories match up. I've never seen this before. This is new to me. Flagging where are we in the process in terms of alignment with the greater literature, and what nuance is emerging from our data, and what possible threads do we need to follow later down the line. We did this many times. So we did this many times. And the next step to this is developing our explanatory statement. So see this, I don't know how Alejandro did that red dot, but if you can see this final statement here and the dispositional statement, we use these to move into the explanatory statements. So these are succinct interpretations that explain how underlying, often unobservable mechanisms can explain abstract patterns. We regularly met to discuss the development of these statements. This is a list of our ICHEMO statements, but nonetheless, sorry, I'm just a little bit winded. The ICHEMO statements and the explanatory statements were developed from the final statements here. They are propositions about how and why, for whom integration works for, the heart of the realist work that we're doing. We needed to structure the next step of our work so that they can actually fit within the heuristics that we were working with. That is the ICHEMO heuristic, which is simply just an adaptation from the standard CMO heuristic. So instead of context, mechanism, outcome, you've got intervention and actor inserted there. And what that does for your work is it helps kind of parse apart the mechanism a little bit more, parse apart the context dependent, and you can pick the heuristic based on which one fits best with your research. So what we did was we took those statements, the explanatory statements, the final statements, the dispositional themes, and we came up with these ICHEMO statements. This is one ICHEMO statement that has been pulled apart so that you can kind of see the appendages of how we've structured it. So I'll read it out. It's a bit long, but again, this is one statement. So the lack of clear referral pathways and resources being provided to the care ecosystem, intervention, coupled with a high need for specialized care and complex case profiles for refugees, context, leads to service providers, actors to experience barriers to collaboration, burnout, and disengagement from their work mechanism. This leads to cut corners, fatigue, and frustration between organizations and results in refugees not getting the care they need outcome. So imagine a very long list of these ICAMO statements, each one based on a row that of that big table that was described earlier. That is what's here. And they got coded. They got color coded, and yeah, there's just a lot of color here. And what you can see now is where the demi-regularities start to pop up. So you can see like this helped us identify similarities between the context, the mechanisms, and the outcomes. And based on pattern tracking, we started to get and extract broader explanatory principles. This leads to the first version of our IPT. So here, notice that this is just context, mechanism, and outcome. We identified 4 context conditions: cultural and relational factors, system navigation and service access, organization and workforce challenges, policy, funding, and governance. Each of these context conditions have 2 corresponding mechanisms with so that brings us to an 8 total mechanism. One category are mechanisms that promote integration, and the other are those that limit or hinder integration. And that I won't read them out, but I'll give you a link to what these actually are so you can take a look in your free time. These two types of mechanisms lead to 2 different types of outcomes. Those that limit integration or limited, possibly negative implementation outcomes, and positive implementation outcomes. What we did was then revisit the explanatory statements, the ICAMO statements, and the data. And through, I think, weekly meetings, and at certain points more, we discussed, okay, is this, like, what's missing from this? What needs to be represented, and is this accurate to the data that we collected? Is this accurate to the conversations that were had at the World Cafe? And what we came out with was a much bigger map, but one that captures the complexities that we were witnessing. So you still got the 4 context conditions, and you still got the 8 mechanisms and the 2 different types of outcomes, but you now have intervention and you now have actor. So again, I won't read them out. There will be a link in the resources to this particular model if you are interested. But just notice that here, especially in the outcomes, we've stratified them across client, provider, and service level to really accurately reflect the diversity of experiences that the actors were facing, and the different ways that the mechanisms landed within their little pod. So we are nearing the end of our analytical process. And before we close off on what our process looks like, I want to talk a little bit about our interest holder engagement. So we took this model to the original participants. Some of them were the original participants in the study, and some of them were new or colleagues, but we did take them back to the interest holders. And we talked about it with them back in September. We said, what did you like about this? What aligned with your work? Where did you think this diverged? And we got a lot of great feedback. A lot of it was very positive. And the response that was elicited was basically built on the amount of richness that went into what can go into the next revision of this model. We have not yet incorporated the feedback into our model and are planning to build that feedback not just into this model, but into the next phase of our work, which is under phase 2. So that's our realist review. We are planning to conduct a realist review so that we can make this IPT into a mid-range theory. The realist review will be global in scope. It'll have an expert advisory group. It'll contain much more interest group holder engagement. And from there, we hope to consolidate empirical findings by conducting a realist evaluation. These are steps that Alejandro has already talked about. But I think just in terms of just the nature of realist work, it lends itself to practical application. And that's just something I'd really want to emphasize, is that once at the end of this process, like, our goal is to provide toolkits, public engagement work, resources, and across different levels to the community that is conducting this work. This work does not come without limitations, and I'm just going to talk about 3. So first, it's interest holder engagement. We did some in the beginning, that's that World Cafe, and we did some at the end. That was our September event. But ideally, interest holders would be engaged every point of the way. They would ideally feed back into the analysis or developing the tools to conduct the research. So in the future, I think that's something we'd like to do. We're excited to hear, though, that our work does align with their practice. Now, this is possibly a little bit more of a neutral limitation, but data triangulation, where we've only got one source of qualitative data and we didn't necessarily quantify it to try to understand, what are some other ways of viewing this particular phenomena. We did have, a bit of a light scoping of the literature, but otherwise we focused mostly on the data that we collected with our participants. So that could later possibly improve the applicability. And if you want to say generalizability, you can say generalizability, but I might not want to say generalizability right now. And then you've got representation of policymakers. So our networks are predominantly comprised of service providers. However, policymakers are an incredibly important group in integrated mental health care, especially for refugees, given the cross-structural nature of their experiences. And so in the future, I think we would like to try to get more policymakers on board. It's just a matter of strategy and resourcing. I have some resources for you all, and I'll pop these in the chat for you. But I just want to highlight, you can learn more about our World Cafe and actually see this beautiful graphic that is behind this boring white rectangle that Nancy and her colleagues created for this type of project. You can look at our actual research outputs, including that concept map. And the bottom 2 actually, I think, are both Alejandro's Realist podcast and his community. So I've also got readings for you guys. You can read about refugee mental health using all of these citations. You can read about realist approaches that were included in this presentation here. And on that note, I'm going to lend it back to our discussion.
Hello, thank you very much. Before we actually just get into the discussion bit, I just want to let the people know who are watching the recording that hopefully, fingers crossed, in the information below the recording, there should be a copy of all of the references that Mita has just mentioned. So if you're watching the recording, you don't need to pause and screen, get to the screen really, really closely to work out what exactly was written. There should be a list that you can then take and follow them up yourself for the various things. So anyway, thank you very much. In true Realist Hub tradition, which has been going on for some years now, we offer our speakers a round of applause. These days, you all seem to be pretty shy with the whole real applause. and you do the whole virtual one, but I'm doing a real one. So if anyone wants to feel brave, you can join me with the real applause. So you're not feeling brave, are you? You're all using the virtual one. But thank you very much to Mita and Alejandro. See, look, I am like a lone wolf here, you know, charting my own course here with the applause. If you were in a real seminar room, you would actually hear something. So, you know, never mind. So I have to say that was really, really interesting. There are some similarities to how we code. So for those of you who are watching, you can turn your cameras on now if you want to join in the conversation. Alejandro and Mita and I had a quick discussion before we started today over, I think they code differently to me, and they do, but there are some similarities in some of the approaches that we take. And I think it's really interesting. And like one of the first slides that you put up over the recipe book, and you're given commission to be able to look at the different ways in which you can code. And I think that is really, really important that people are aware there are very many ways that you can code, and that it's up to you to work out the way that works the best for you, the wider team, if you're working with a team, and the data that you are collecting. And on the projects that I've coded, that I've personally coded, we've approached it slightly differently every single time. So I think that, you know, in a sense is, you know, I have a very sort of broad approach to it, but it's very similar. So questions. Anyone got any questions for these researchers? So what we'd kind of like to do is just screen the questions to make sure they're appropriate for the presentation. So please pop them in the chat, and then we'll come to you, because sometimes we get questions on completely unrelated topics to the actual talk, and I don't wish to put people on the spot with questions that are not necessarily their forte. So if you could just pop your questions in the chat. So one of the things that I had, and I totally agree with you about creating, you know, when you code individually, and you could end up having like a whole list of categories of like context, mechanism, outcome. They're not configurated, and you just end up with a whole list of contexts, a whole list of mechanisms, and a whole list of outcomes, and you don't know how they join together. So by coding in dyads or triads, you get over that. What do you do if you have a document or a source, let's just say, that is rich in context but very little else? What would you do with that?
Mita, you wanna answer first?
Sorry, Joe, can you please repeat the question? I'm trying to
Yeah,
catch it in the chat.
if you are looking at, I agree with you about what you're saying about coding individually. So you end up with like a list of context, a list of mechanisms, and a list of outcomes. And if you don't try and configure them in some shape or form, you don't necessarily know how they relate to each other. But as part, especially for an IPT, if you're trying to map the wider area, if you have a document that is exceptionally rich in context, and part of me, and at the moment I can't think of a concrete example, but part of me is thinking something maybe around policy. What would you do with that document if it's exceptionally rich in context, but may not necessarily have, it's unlikely to have any mechanisms, but may not even have very many outcomes, but could be very relevant to the wider context of which you're exploring? I'm just wondering how you would bring that in, because it could be very relevant to the review.
That's a very good question. I guess that for us specifically, sorry, can people hear? Yeah, can people hear me? Okay, fine.
Yeah.
So we, in this initial IPT development, we used these deliberative dialogues. So we used this interview transcripts, and those have been like which again you could say around the data triangulation, like one of the sole areas of developing this initial IPT. Once we've moved to the review, we are taking more of the grey literature to try and extract those more other features. It is true that in some of the interviews, if we're talking specifically about this IPT that we've done here, some of the participants were very clear. You know, if you were speaking around service providers, for instance, they're going to talk much around their context and what it is, but not necessarily always we're going to be very clear around the mechanism. So I think there's two things to do that. One is to make sure that those texts or those contexts that are sitting in one area are not in isolation. So are they supported also by the other interviews and the other ideas to go into those patterns and demo regularities that we were talking about? Because you have only one contextual condition in one area, but it's not really being supported by many, may not be something that has the strength to be like, this is something that is happening at that regularity level. And the other piece as well is to think around that retroductive inference, to try and get those wide, deeper questions. So if something is like, for example, the diet question that we showed, where it was in our perspective, like a context outcome, for instance, having that kind of, you know, theoretical ability to also go a little bit beyond what the participant's saying, to see what could plausibly be going on here, to try and link that context so it doesn't just become in isolation, but it links to other things. So those will be the two ways that for this IPT specifically we've dealt with that, but I'm not sure, Mita, if I've missed anything.
And I think also as well, if you're doing an interview, it's easier to go, okay, I've got loads on context here. But I suppose for me in my head, I was thinking about a static document where you're faced with what you've got rather than an actual interview. So yeah, great. We've got some questions starting to come through with the chat. So let's have a look. First one is Georgia. Did you use any software to help organize your data?
That's a great question. And I actually think one of the strengths of the analysis that we've done is that everything that we did was in Word and Excel. So for why is it a strength in our sense? Because it's very accessible. So it's very accessible that everything that we did, all the codes, all the ideas, using Word, Excel, and Miro boards. So Mita did an amazing board in Miro boards. I mean, when it comes to this amazing, beautiful things, that through the Word documents, so through the different transcripts and having all the coding at once, so Mita and I working on like those, so we can both see our analysis at the same time. That's how personally it worked for us. So we didn't necessarily use any software. Advantages and limitations of using it. I think the advantages of what we use it at is very accessible, and you don't need to have a tremendous training in one specific software in order to use it particularly. And we were also in a bit of a time limit to get this done. So we thought let's do something that is very pragmatic as well. So if it's pragmatic, accessible, which is good. Maybe one limitation of not using software, maybe some of those nodes that Sonia Dahl can use, or some of those patterns that you may use in like software, or using some of the tools and resources that Word doesn't have, maybe would have given us some more perspectives on some other things, which is probably true. But to counter that, we did have all the expert advice from Nancy and Ferdy to help us to get in those patterns and ideas beyond beyond our understanding of the data. Because like anyone here that can appreciate, when you're in the weeds of an analysis or in the weeds of something, sometimes it's hard to zoom out and look at some of the other ideas. So having that external advice was also really useful.
I know I use NVivo, but it has its challenges when you are working in a team. And we work across different, I use Mac. Maura, who I work with over in Canada, uses Windows. So that creates even more challenge to sharing the different things. That does get complicated. We usually do first round, if you like, so it's probably what you did in Excel, we do in NVivo, and then we also put into Word later, because that's you can move things around as well in Word, and you're constantly moving bits of data from one section to another as your thinking develops on what that particular CMOC or IPT is shaping up into. So does that help answer your question, Georgia? If you could just give us a thumbs up in one of those virtual thumbs up that I hate so much, just give me one now and let me know. Great. Okay. So then we're going to move on to Beth. Beth's got two questions. So one of them is, you want to come on, Beth, because I think this might be a little bit of back and forth here with this one. So she's saying you could probably get a lot of context mechanism dyads and how to frame the questions to get the highly coveted mechanisms. So this is a plea from me. Before you get into this, Alejandro, this is a plea from me. I'm about to upload some papers, fingers crossed, in the next few days on our latest evaluation, and in the supplemental material will be some actual real examples of questions that I asked service users, so that you can see questions that I started to ask around theory gleaning, theory refinement, and theory consolidation throughout the whole of the evaluation. And what I would really like is for us as a community is to start including in our supplemental files some examples of questions, because asking questions in a realist way is different to standard research. And for those of you who feel more confident in just like putting your hands up and going, hey, this is how I did it, you don't have to do that way, but you can. Please consider putting a supplemental file up with some example real questions taken from your transcripts so that people can see how you decided to ask the question to elicit those mechanisms that can be very, very challenging to get. And there are some people, and I'm sure you had this as well, Alejandro, who just don't want to get into discussing mechanisms. And that's just who they are.
That's absolutely right. And just I just want to make sure, Beth, that we're answering the question as exactly as you wanted to. So is it specific to what Joe as well was saying around covering mechanisms in those diets and triads, or is this anything more specific?
Yes, no, exactly that. The kinds of questions you might not have on the topic guide, but that you actually asked during the interview. That's exactly what I'm getting at.
Mita, do you have any thoughts on that as well? I know I've answered a couple now.
No, that I think makes sense. I don't have enough, I don't think I have enough direct experience developing questions on my own, but when I engaged and outside of this project actually, when I engaged my expert advisory group on getting deeper, I'm very curious to know, Joe, if this aligns with your perception of realist inquiry. But we were asking questions about structural discrimination, and that can get quite abstract.
Yeah.
Yes. And so when my advisory group comes from around the world, I think what helped me most was to say, okay, if we're talking about policy and why this particular policy, what had to happen in order for this policy to work like that, the answer is most often than not discrimination, but we want to get deeper than that.
Yeah, you need to go underneath that. Yeah.
Exactly. So I think what helped me was say, okay, well, this same policy was implemented in Mexico, and what about that policy? Like, obviously the discrimination is still there, but like it works differently. It works differently in Mexico than it does in New Zealand. What is the similarity between them? And where are they different? And how does discrimination then manifest differently? And then when you compare those locations, I noticed that my advisors kind of got it a little better. And when you change the level of the inquiry too, so we were also looking at community-based interventions. I was like, okay, well, there's a similarity in resource distribution at the community level and a similarity with resource distribution at the policy population level. Why did they come out with the same outcome? Why did they not work? What about those two levels? Was it like the actor and like kind of feeding them a little bit and then taking it back away and then changing your mind and saying, well, contradicting yourself really helped them get to that. It was still a bit challenging, but I hope that helped.
Go on and add on, Alejandro.
No, just a little add on as I was thinking, Beth, to your question. Usually as well, I mean, I don't know if anyone here has had any coaching experience or coaching approaches of any kind, but one of the first things that they teach you in coaching is, when you ask why, sometimes that can feel a bit of a judgment or people can get a little bit defensive if you ask why too many times, repetitive. So even just asking what is it about X that makes Y happen sometimes can get people to talk a little bit more in detail. So if someone says, oh, this happened, oh, so why? Tell me why. Sometimes people can close up as well with necessarily with why in a very explicit way. So you can say, oh, so what is it? So I had this the other day that someone said to me, oh, I just love learning. I love doing courses. I'm a student of life. So I was like, and I just, okay, so what is it about learning that makes you feel alive? What is it about it? Oh, it makes me feel X, Y, Z. And it got into that kind of conversation. So also just reframing the why towards something that, first of all, it's obviously engaging for the participant, but that feels that it's not an interrogation, but a conversation, that also can be quite useful. And also importantly, what you're going to have in your realist interview and in your realist questions, what you also have in a way, it's a little prop, which is your initial program theories or your ideas, your explanations, your hunches that you're going to start refining, refuting, or confirming in those conversations. So you always can go back to those ideas. Don't feel you're on your own in that sense, in that conversation. That realist interview is going to be slightly different, and the little ideas that you're bringing, you can also hang on to those. If you don't have to test every single piece of your IPT in one interview. So if this is not working necessarily, maybe another
Move on.
piece we will, and you can move on. You don't have to take, like, for in our IPT that we've just shown you there, we can't ask a service provider around the culture, about the policy, about, it's not going to happen. Can you say, for this individual very purposely, what is it exactly that is going to help me use, and how can I have a conversation rather than an interrogation? Because sometimes a why can feel that way, to try and get into those deeper mechanisms. If they bring with some information, fantastic, and if they don't, it's just an interview.
Yeah, some people are just not very good at eliciting mechanisms, but you can get loads about outcomes and context from them. So you can do that. Beth, stay on at the end and you can tell me what your topic is, and I'll see if I can give you a couple of starter questions to help you feel more confident in switching the questions around so you can have different ways, because maybe we can give you some very concrete examples for your own project. Maybe I need to do a course on realist interviewing. So I have done quite a few of these now. So also, I think there's been a little bit of confusion, and I'm just going to mention this. So I do start out with an IPT. But actually what I do is I properly refine the PT after I've developed all of my CMOCs at the end of the review. So I think that might be a little bit of confusion, maybe talking or, just things being said fast. But I always start a realist review out with an IPT. It's kind of like the underlying bit that helps to understand your research question. But what I do is I gather all of my data, I get all of my CMOCs, and the very last thing I do is properly sit down, usually with my team, and we refine the program theory. But we'll have already done it in bits, but it will be that, the final polished version that goes into the project. So I hope that's helpful as well. So we'll move on to Faye's question next. Faye.
Hi, yeah, I was just wondering, I put it in the chat. Hi, that was an excellent presentation. Thank you so much. It was really, really interesting and very, very clear how you spelt out your thinking. So thank you. But I just wondered, on a practical level, how often you felt yourself moving in a linear way through those different ways of thinking, from experiential to onwards, and then how many ways backwards, how many ways side, how many times did that look like a chewed up piece of string, and how many times did it look like a nice linear pathway?
No, that's a great question, Faye. Look, I think from our experience, the experiential themes tend to be quite straightforward in a way, because you're sharing what the participant's saying. You're not going, too much beyond what it says on the transcript. So when you're using the dyads and triads as the quotes and the ideas, the experiential themes, I don't think Mita and I spent, too much. You still have to read it and make sure it's there, but that was fine. It is that movement, I feel, once you start getting a little bit more abstract from experiential to inferential, that sometimes teams can struggle a little bit more with, because you're trying to think, how far is too far? How far is it enough that I'm still true to the data or the participants saying, but I'm still getting a retroductive, theorizing, mechanistic thinking? Because that's where the dispositional theme comes in. The dispositional theme at the end, that is more, it is plausible to claim. Sorry, it is plausible to claim. This is the inferred phenomenon is dependent upon, i.e., that's the mechanism. So that bit in between, I think that's where Mita and I spent a little bit more time, the inferential, because the other two are a little bit more extreme in a way, which is the petals of the flower that you can see, the roots of what's causing it, which you have that, and I know you work a lot with creative approaches as well. You have that creative license sometimes to go a little bit deeper and have that inferential approach. So it is there in the inferential bit that you have to be careful that everything links, that you're not going too much detached from what it's saying, and that's also useful to triangulation with data. So to answer your question, I think that to be careful about the sideways, I think the more sideways meet, I don't know if you can confirm or refute this, but from my experience was the movement from experiential to inferential, that bit there, from inferential to dispositional. Sometimes that's a little bit easier because you've already started the abstraction, but it's that first decision to make of how much stem we have to put in there.
I actually have a slightly different perspective on this, because I think this is more about my personality and perspective as a researcher, where I tend to really jump to the abstraction. And I actually had to really hold myself back from going too quickly into the inferential, but especially the dispositional. Because like when you read the whole transcript and you know the research context so well, you start to explain things, or I start to explain things as I read it. And so for me, as an individual, I actually tried hard to stay on the linear path so that I can stay organized. And then with the group, as the group work started to increase and as we started to approach those dispositional themes, I found that linearity to be quite helpful. But at the very end, I went back to, like, I started breaking that linearity quite a bit just to like go back to the data quite frequently to like I was like, okay, well, where did this dispositional theme come from? Why does Alejandro think that? Like, why did he write this explanation down? The data answers your question, and that's when that like circular stuff starts to happen. Yeah, hope that helps.
I
That's a
would
great
agree with
answer.
that.
Thank you.
And I think, Faye, I think I'm sure I said this to you in our sessions, but those of you who've had one-to-ones with me will know that I say you've got to find a way that works with you, the way your brain works and the data that you have. And this, I think, Mita, you've just sort of like explained why that is and how you come at that. And also, all of your CMOs, all your program theories should be backed up by data. I should be able to look at the data underneath that, just as you've done, and gone, oh, okay, I see why that's here. There shouldn't be anything in that CMO that is missing in the data. And that means that if you are someone that knows the topic really, really well, you might not ask enough questions. So you have to ask enough questions. You have to ask the obvious to get your participants to elicit that obvious, which you already know, so that you have that in the data. Otherwise, the CMO is just something that you've created, and your program theory is something that you think is going on. You haven't actually properly tested. We're running out of time now. I'm happy to stay on, but I don't know about you guys, but I'm just wondering if we can maybe combine two questions, if that's all right. So Rasha and Yvonne, I think, have got very interlinked, related questions. And Sandra and Lisa were talking about how do you do this if you're on your own as a PhD student. So can you quickly have a good look at those, Alejandro and Mita, and then if we can try and combine those and answer them together, and we can ask them if they feel we've answered the questions for them, so that we're not still here at half past.
Very quickly from me. So when it comes to the, doing it on your own, I agree that in the paper that we've written, that is one of the things that we say as a limitation. I say this is it's quite an intensive analysis process, and there's 4 people in the team that have already done Realist in the past.
Yeah.
So we're not starting from zero. And you're combining approaches. So, you could do an analysis just on linked coding. You could do an analysis just on realist thematic analysis, but we use the strengths of both to start configuring from the start. So the question is, what are your resources? What are your experience? And what is the team composition? You may on your own feel that you're comfortable to do that, and if you have that relationship with your supervisor to start questioning those conversations like we've had with Mita. But absolutely, it's not I wouldn't say it's an approach that can work in every situation at all. But if you feel that you want to go into that depth ontology quite in a systematic way, using those levels of reality, experiential, inferential, dispositional, empirical, actual, real, then it can work quite nicely. But it's not the only way. So I would say if you're on your own as a PhD student, I would take caution of maybe the whole approach. But there may be areas from that you may absolutely may like and may want to pinch. If it is the preparation or the linked codes or one of the things, I would absolutely do that. Mita, I'm not sure if you have anything else to add.
No, not particularly, just more anecdotal. I can really relate to having to doing this kind of stuff without a team, and yes, having one is really, really wonderful. For me, I think my experience has been more about just bringing in other people from the community and explaining my logical process. And if they can't talk on the content, that's okay. But just for them to, if I were to do this again by myself, I would absolutely reach out to Alejandro and say, here's what I'm thinking. Here's like, these are the steps I've taken. These are the questions I'm asking. What do you think? Yeah.
One of the things I would recommend to you lone PhD students out there, find a buddy. buddy up to someone who is at a similar process, completely different. So I did this. So at Nottingham, we had a bunch of us at Nottingham, and I still found my little buddy. And you end up at a similar point in the process, and you help each other out. So you have to be very disciplined. One week you are meeting for your project, the next time you meet, it's for their project, and you use them as your sounding board to help you go through, because the PhD is a very lonely journey, and a realist PhD is an exceptionally lonely journey. So find your realist friends. That's my big advice. Find your realist friends. So can you have a quick look and see whether you think Rasha and Yvonne's question can be combined or answered together? Rasha's had to go, but I've said if Rasha feels that the question isn't answered, so if you're watching this back now, Rasha, please take it over to Ramses, where I'm sure Alejandro and Mita will pick it up if you feel like you've got further things that need to be answered. I've just committed them to doing some extra work, but you know, I'm sure Alejandro will do that. And I don't know Mita yet, but I'm sure she will.
Very quickly, Yvonne, thank you so much. That's really useful. Those dyads and triads in this specific approach, making inferences, that the inference comes mostly from the ICMOs. So the CMOs get started at the start of this process at the step 1. So you're not necessarily at that stage already making inferences between dyads and triads. It's getting started for the experiential theme to get to the ICMOs. What it helps you do is that once you're doing the experiential inferential, you're already thinking in configuration. So that is the purpose of the dyads and triads in this approach. If you read Jackson and Kolla's approach in 2012, you'll see how they use dyads and triads for the whole process. If you read Wiltshire and Ronkainen, how they use realist thematic analysis for the whole process. We've just tried to use the strengths of both to combine it into one, essentially. So for this one specifically, the inferences didn't happen at that level of analysis just yet. It happened more at the ICMO, the little color code that Mita showed. We color coded that to be very clear in the context. Oh, okay. So it seems that there's some patterns around this cultural elements. Okay. Some patterns around the policy, governance, etc. So the purpose of the CMOs here is to think in configurations from the start and to start building the experiential themes, not necessarily to make inferences at that stage. That would be my answer to that. I don't know, Mita, if you have a reply either.
I think just very similar. I think the way that you phrased it, thinking in configurations, was really took my answer. So yeah, I'll leave it at that.
So Sandra, if you're still on the call, Lisa might have gone, so she might not have got your email. So you might need to, I've done this successfully, actually, stalk her through something like ResearchGate. So you might have to go looking for her to see if you can find her. But actually, that'd be very good. One of the things I should do is also chart the impact of this place. I know I've connected people. I know that people who've presented here have been invited to join groups. I know that there's been a lot of people who've presented here who actually ended up in Anna and Emma's book last year. So they presented here first and then got invited to do the book. So I think I'd be really interested in the reach of the hub, because largely it only happens if someone tells me about it. So, you know, if you've found a friend through the hub, let me know, because I find it fascinating. So as usual, I will hang on for the next about 20 minutes. If anyone has any questions that they want to ask, if anyone's got any burning realist questions, let's face it, sometimes I can help answer something in 20 or 30 seconds that you've been spending months and months worrying about. So just stay on and ask that question. Anyone is welcome to stay if they want. I will try and work out how to turn the recording off, but we generally don't record this bit. We say goodbye to Alejandro and Mita, and we thank them for their talk. And this will hopefully, the recording will be about a week, I think, depending on how ill Lauren is, because she's the one that sorts out the recording. So hopefully she'll get better soon. But thank you once again, guys. That was absolutely fantastic. And it's so great to see an in-depth analysis of how it's inside your brain, really, of how you approach that coding, because I think that is the detail that's currently lacking in the literature. So thank you very much. So thank you very much.